Hi, today I'm going to talk about relaxation strategies that can be used for children. This is part 3 of a 3-part series on how to help anxious children. The first part was on the use of cognitive strategies for fighting off worry thoughts, and the second part was on the use of exposure or practice to help kids get over anxiety they have about doing certain things. And today I'm going to talk about how to help children relax. This is very important when you're working with a child with anxiety because if the anxiety gets too high, none of those other strategies will work. The child first has to reduce the level of anxiety before then they can go ahead and talk logically about something, or before they can go ahead and practice or rehearse doing something that makes them nervous. So it's very important to teach relaxation skills as a part of working with a child who's anxious. And one of the basics of this is breathing skills. So if a child is getting anxious, they're going into kind of a fight or flight reaction, and in order to turn that off and to bring their anxiety level down, they need to use some breathing skills to reduce their stress. So to do this with a child, though, I think you need to practice with them before they're anxious so that they know what to do. You basically want to be teaching them ways to breathe, the way we might think of diaphragmatic breathing. Breathing very deeply, filling up the lungs deeply and slowly, and then exhaling in a slow way. So to do that, I use some different strategies. So for instance, I might use something like this pinwheel, and I might have the child have fun blowing on it quickly to make it go fast a few times just for fun. But then I'll ask them to see if they can make it move as slowly as they possibly can. And so I'd have them practice breathing in really slowly, often breathing in through the nose in a very slow breath, and then trying to make the spin wheel go as slow as they can when they breathe out. Something like that, so that they're learning what that feels like to breathe in slowly and to exhale slowly. Another way we might do that is through the use of blowing bubbles, which can be fun, and you really can't do it if you do it really fast. So we might go, where they're practicing blowing a bubble, or even blowing up a balloon is another strategy. And another way you can do it is to take something like a light plastic or paper cup and place it on the child's belly, except the child is laying down. And if the child is laying down with that plastic or paper cup on their belly, you want to have them practice moving the cup up and down by deep breathing, so deeply that it's almost as if their belly is rising and falling, and it is. I sometimes have to explain to children that yes, it's true that their lungs don't go all the way down to their belly, but if you're doing very deep breathing, deep diaphragmatic breathing, it will make your abdomen rise and fall. And so we want to have them practice that and do it at different times when they're not anxious, so that then when they're anxious, they have a way of deep breathing that really works for them. And that they've practiced and rehearsed many times. And it's great to tell kids to practice it, for a minute or two right before they go to sleep. And if you're helping put the child to bed, that's a great time to practice it as well. You could also introduce some mindfulness into that practice. Now, mindfulness is when you just focus on one thing at a time in a sort of a neutral, objective, and non-judgmental manner. And a very easy strategy for teaching mindfulness to children is to have them count. So for instance, while they're doing their deep breathing, they might be counting and focusing on that counting. So maybe with the inhale and the exhale, that's counting, and maybe you start at 10 and go backwards to 1. Starting at 10 and going backwards to 1 is just slightly more complicated than going from 1 to 10, and that's a good strategy because it keeps your mind focused on the counting rather than wandering off to all the other things you might want to think about. So mindfulness is when you focus on one thing at a time, and if the child is focusing on starting at 10 and counting backwards to 1. While they're deep breathing, you're getting the benefit of both of those strategies. The use of mindfulness to keep your thoughts focused on one thing at a time, and the use of the deep breathing to relax the body and the mind. And so both of those things combined can be a really powerful relaxation strategy. And again, you want the child to practice doing it when they're not stressed, so that then when they're very nervous about something, they've practiced it so many times that they know how to do it well. Another thing that you can use is some progressive muscle relaxation. Now, there's lots of strategies on this. If you Google progressive muscle relaxation, you'll get a lot of strategies. But I like to teach the kids something very simple that they can remember easily. So we might go through a quick muscle relaxation strategy where we have them work on some of the parts of the body that are just most likely to tense up. So for instance, I'll sometimes tell them to take their arms. We'll do what we call muscle men, being a muscle man or muscle woman, where you tense up your arms, you hold it 1, 2, 3, 4, 5, and then relax to the count of 5 and take a deep breath. Then we'll have them do a walnut face, where they scrunch up their face really tight, so they're making lots of wrinkles like the way a walnut would look, and they hold it for the count of 5. And then relax for the count of 5. Then I have them do shoulders to ears. So hold their shoulders up to their ears for a count of 5, and then relax their shoulders down for a count of 5. And then I will sometimes also have them do their legs, where they stretch their legs out in front of them, the way I'm doing my arms, and push their feet back, toes back towards them, and hold that for a count of 5. And then relax for a count of 5. And taking a deep breath in between each of the different exercises. So they do their arms and their shoulders and their face and their legs. And that's a very short and quick progressive muscle relaxation skill that kids can learn very quickly and practice very quickly. And then again, when they're very tense and anxious, that would be a good relaxation skill for them to use. And then lastly, I'd like to mention that the use of imagery or visualization can be very good. So sometimes I'll have children imagine a place that they really like. It could be a place either that they have actually been to, or a place that they've only been to in their imagination that is for them a very calming and relaxing spot. So for instance, when I do this for myself, I like to imagine being at the beach and watching the ocean waves and listening to them. And we try to think of engaging multiple senses, like what would something look like? What would it smell like? What would the air feel like? So someone might imagine, like I did, being on the beach or being up in the mountains, or maybe being at their grandparents' farm. Or I also like to suggest that people imagine a safe room or a safe place. So especially for children who've been through any traumatic experiences, their visualization might be a safe place visualization, where they imagine a fortress or a room that no one could ever get into, where they're very safe and protected and no harm can come to them. And it's also a very pleasant and wonderful place, not just a castle fortress, but it's wonderful and beautiful and safe and protected. And so a safe place visualization can be a great skill for an anxious child. And again, just like these other skills, you want to have the child be practicing it when they're not anxious, and then they're much more able to utilize that when they are anxious. So those are some different relaxation strategies that can be taught to children. My name is Barbara Lester. I'm a licensed clinical social worker. I specialize in working with children, adolescents, and if these skills would be useful to you, I also refer you to the 2 other videos I have that I mentioned at the beginning. One's on fighting off worry thoughts, and one's on the use of practice and exposure for anxious children. This is part of that series. So give some of these things a try and see if they help your child. Thanks for stopping by. If you'd like more tips like this, please subscribe to my YouTube channel, which is ASD Specialist.